Good morning everybody and happy Wednesday the 28th of January. Weather update here in Weems Bay. So far quite nice and sunny but still cold. Anyway, for the main reason for speaking today is to summarise the publication of the Stage 1 Non-Surgical Procedures Bill that was published yesterday in the Scottish Parliament. The Scottish Parliament Committee, Health and Social Care Committee, backs the bill to regulate non-surgical procedures, which is fantastic news for our patients and our medical aesthetic sector. Making you secure in the knowledge that you will be treated in a regulated clinical environment at minimum under the supervision of a qualified prescribing healthcare professional. The committee does ask that there is appropriate support and guidance to aid the transition, however, acknowledges that patient safety must be the overriding priority. Also for future discussion includes the supervisory capacity from a suitably trained prescribing healthcare professional, minimum educational standards and audit procedures to measure any activities, procedures and clinic accountability and data gathering, which is currently an ongoing process for registers his clinics away and has been in place since 2016. So this bill will in fact bring all providers of injectable treatments up to the standard of currently regulated clinics in Scotland, so reducing any disparity between one injector and a healthcare provider. There is also the question of enforcement, which will be amended to make it a deterrent for any scrupulous injectors. Couldn't read my own writing. Finally, they talk about the importance of a public information campaign to raise awareness of risks, which in my opinion is far overdue. So there you have it, my summary of the publication from yesterday. It's been a long, hard time, and since I first contacted Stuart McMillan, my MSP, way back in 2018. So in 2026, our hard work is finally coming to fruition. It's with grateful thanks that all those hard-working healthcare professionals, members of the Scottish Parliament, policymakers and lawmakers and many more behind the scenes have come to this, brought it to this stage. So after the debate in Parliament on the 5th of February, to which myself and colleagues are going to, there is a further debate within the committee to consider the amendments. It then goes to stage 2, and then there's other discussion, stage 3, and then royal assent, and it becomes law. So this, I remember John Spinning saying in Parliament a year or so ago that he expects this to be completed by March 2026, which is only a couple of months away. It's been very in-depth and involved, so it's unlikely it'll be March, probably April, but it certainly will, hopefully, fingers crossed, be implemented before the election in May. So I understand that will be a transition phase and it will take a few months, even a year or so, to get every genuine aesthetic provider up to date with the new regulations and regulated by their appropriate body. Thanks for listening. I'll update you as the time goes on. Have a nice day. Bye.